Hello everyone, I am Dr. Varun Joshi from Joshi Hospital Jalandhar. Today I will be explaining how we do Bankart at our setup. So first of all, we read the MRI which clearly shows anterior-inferior Bankart tear and Hill-Sachs lesion in the posterior aspect of humerus head. First we start with the diagnostic arthroscopy from standard posterior portal, and then we insert our spinal needle through anterior portal, after which we insert dilator over it, and over that dilator we pass our transparent plastic cannula. Once cannula is inserted, then through anterior portal we elevate the torn labrum through elevator. This is the main step for the Bankart repair, and we should give sufficient time to elevate this labrum from the glenoid. Once labrum is elevated, then we use the bone rasp through anterior portal and we raw the area of the glenoid so that our capsule and labrum it gets repaired. Then with the help of grasper we try to pull the elevated labrum and capsule and check that at what site it can be placed properly and whether it can form a bump or not. In case of any constriction, we insert a shaver through anterior portal and then we remove that constriction also so that our labrum is properly placed. Once everything is done, we move back to our posterior portal and head of humerus and we insert a 5 mm titanium anchor over the Hill-Sachs region. Then we move back again to glenohumeral joint into anterior-inferior part and insert our sleeve for the anchor placement. We use 2.7 mm peak single loaded anchor. We place it over anterior-inferior aspect, that is around 5 o'clock position. Then we pass our suture from lasso technique and bring it forward through accessory anterior lateral portal. Then we apply a Duncan sliding knot over the passed suture and give it a traction so that the knot it gets slided over the passed suture from the labrum and the capsule, and the labrum sits back at its position. To reinforce the knot, we again tie it with the half hitches, 3 in a straight way and 1 in the reverse manner. Once we are sure that our anchor is well placed, then we cut the knot with the suture cutter. We take another 3 mm anchor and follow the same procedure, taking bite from the capsule and labrum and then tying the knot, thus making a bump over the glenoid to prevent dislocation of humerus head while movement of the shoulder in future. We reinforce the knot in the same way so that it sits properly over the glenoid. Then we cut the knot. Then to check the stability of the joint, we pass a hook and try to pull the labrum, and it is not getting pulled away, so confirming the stability of our construct. Now we move back for the remplissage repair. The first anchor that we inserted over Hill-Sachs lesion in the humerus head, we pull the one of the sutures through the posterior lateral portal. We take a bite from the infraspinatus and the capsule. We take that. We try to pass the suture from the infraspinatus and the capsule. Once it is passed from the infraspinatus with the help of the lasso and as well as capsule, then we retrieve that suture. Once suture is retrieved outside, then we confirm it that it is not getting entangled in any soft tissue, and then we tie the knot over that suture, and you can see how beautifully infraspinatus and capsule is filling the defect of Hill-Sachs, and it is covering whole of the Hill-Sachs defect.